Well, happening around Arkansas, more than 30 high school students are training this summer to become the first volunteers for a new peer-to-peer youth support text line. It's called Our Teen Connect. This app is to be the state's first peer-to-peer youth support text line, and it is to help youth who are experiencing loneliness, anxiety, or emotional distress to have a place that is judgment-free, confidential, and text-based to be able to go to.
When you're having a mental health struggle, whether that's a moment of isolation or heightened anxiety around a transition, we want you to start reaching out for support then in hopes that you might never have to make it to that moment of crisis.
Well, the program is set to launch this fall, and according to students participating in this, they say, well, they hope the service will make it easier for teens to seek help from someone their own age.
Of course, finding a doctor can be a challenge in a state like ours, especially the farther you get away from Little Rock or Fayetteville.
But as Jada Daniel shows us, she spoke with leaders at the Heartland Health Institute to find how the nonprofit founded by Alice Walton is working to place more doctors out in the countryside.
For many Arkansans, accessing health care means traveling long distances to see a doctor or simply going without.
They don't even have a single primary care provider within their county. Many Arkansans drive more than 50 miles to get access to health care. We need more providers to live here and work here so that Arkansans can get the care that they deserve.
To help fill the gap, the Heartland Health Institute has launched a new graduate medical education technical assistance center to expand residency programs across the state.
And it's not an education issue. We graduate about 430 physicians every year, but we only have 375 places for those students to go to complete their residency programs. We know, based on national data, that physicians stay in practice within 100 miles of where they complete their residency.
The effort comes as Arkansas continues to rank near the bottom nationally for chronic conditions and overall health, leading the nation in maternal mortality and having one of the highest rates of preventable premature deaths.
Consistently ranks at the bottom for obesity, diabetes, and hypertension. We need physicians to help support Arkansans in managing those chronic conditions. We at the Alice Walton School of Medicine are creating a platform and a pathway, a pipeline to graduate additional physicians, but we need to retain those physicians across the state.
Leaders say expanding residency opportunities is one of the most effective ways to keep physicians in Arkansas, and they hope this new initiative brings better access to health care across the state.